I think we'll make a start. Welcome everyone to the September Health Law and Ethics Network seminar. Today, we're going to be speaking about what does success look like in the drug checking arena. I want to first of all start by acknowledging the Aboriginal and Torres Strait Islander people of the unceded lands on which we are meeting today. In particular, I want to acknowledge the Wurundjeri Woi-wurrung people, the traditional owners of the land where the Melbourne Law School sits and the University of Melbourne. We would like to pay our respect to elders past, present and future and acknowledge the importance of Indigenous knowledge in the Academy. So we have two speakers for you today. They are going to speak. We have Associate Professor Anna Elson and Associate Professor John Fitzgerald. They're going to speak one after the other. I think we're going to have Anna speak first. So I'll just give a brief introduction for both speakers and then we can get into it. So Anna Olson is Associate Professor of the Social Foundations of Medicine in the School of Medicine and Psychology at the Australian National University. Her interdisciplinary program of research combines practical and critical approaches to public health with a particular interest in marginalised populations and qualitative methodologies. Managing co-design and evaluation projects, she is experienced in gathering evidence and negotiating practice with large and diverse teams, including consumers and advocates. Associate Professor Olson's research outputs are regularly used in practice and policy translation, including novel health service design and legislative change. Most recently, Professor Olson led the evaluation of Australia's first festival and fixed site drug checking services in the ACT. And following Anna, we'll hear from John, who is an expert in alcohol and drug policy, working across the humanities and social health humanities, social and health sciences of illicit substances. His research focuses on the lived experience and cultural and market significance of psychoactive substance use. He has disciplinary expertise in ethnography, social science, research methods, continental philosophy, discourse analysis, and health promotion. Since 2020, John has led the Victorian government's funded rapid drug monitoring program, which provides health intelligence about the Victorian illicit drug market. In 2020, his second book, Life in Pain, Effective Economy and the Demand for Pain Relief, was published by Springer. So very lucky to have such distinguished speakers here today. So I will now hand over to Anna. Thank you.
Thanks, Chris. Thanks very much for inviting us. As Chris mentioned, I'm from ANU, so I'm coming in from the unceded lands of the Ngunnawal Ngambri peoples. And a lot of the work I'll be talking about today is actually based here in the ACT as well. And I've known John for most of my career, actually. met him when I was a baby researcher, and so it's lovely to loop back around and do this with you, John. Thank you. Okay, so I'm going to do a really quick introduction around what drug checking is, and then talk you through some of the evidence that we have, and then John will raise some of the remaining questions that we have around drug checking before we head into a discussion. So, drug checking's been making the news a lot in Australia over the past sort of 5 years or so, particularly in relation to festival-related deaths and young people. And, it's sometimes presented as this kind of, new and really interesting intervention, when in fact it's been around for decades. It sort of, started off slowly in Europe, was, way back as the 70s, and became more established with the Drug Information Monitoring System, or DIMS, in the Netherlands in the 90s. So it's been around for a long time. And you'll find it across many countries in Europe, and more recently in the Americas and New Zealand. And particularly in the Americas, that increase in drug checking has been related to the increase in opioids over there, and Canada and the US have recently seen a real boom in services in response to checking the drug market over there for fentanyl in particular. So what is a drug checking service, or a drug testing service? I should say I slip between drug checking and drug testing, and you will have also heard of it as pill testing. So there's kind of some fluid language there. I've slipped away from using pill testing because it involves more than pills. Powders, capsules, as well as liquids as well can be tested. So drug checking is probably a more common way of referring to these services these days. Ultimately, they're aimed to be a harm reduction service. And what do they do? People bring in samples of substances for chemical analysis. The intention is to notify people of what's in those substances. Generally, drug checking services also offer harm reduction advice on safer use of drugs, reducing the harm of drugs, and increasingly we also see drug checking services are linked to a warning system. So, and particularly dangerous new drugs will see a notification go out to the health system and or to the public. And we've increasingly seen those across Australia at the moment related to drug checking services, as well as sometimes police seizure data as well. So drug checking services is different types of models. There's lots of different ways that you can offer drug checking to a community. So festivals, where we probably hear about most in Australia, and at festivals they're often referred to as front of house and back of house. Front of house means that there's a service and people bring a substance in for checking. Back of house means that, you know, anything that's found just discarded on the ground, dropped, lost, or confiscated by police gets tested. There are also mobile services, so we don't have any of those in Australia at the moment. There's a fixed site service, which is a bricks and mortar service, and we've got 2 of those in Australia now. And also in Europe, there are postal services where people can post in samples as well. So different service models. So where are we at in Australia at the moment? I mentioned that, you know, you would have increasingly heard about this intervention and advocacy over the past 5 years, but in fact there's been advocacy for drug checking for decades. In the 2000s, there were some sort of guerrilla drug checking that occurred in festivals in South Australia, and there's been, you know, other instances of that as well. It wasn't until 2018, 2019 that saw the first government sanctioned drug checking services, and that happened at two consecutive Groove in the Move festivals here in Canberra. So they were volunteer run, but were sanctioned by the government and the police to go ahead. And both of those were evaluated, one internal evaluation and one external evaluation. And based on that external evaluation that was led by a team I worked with, the ACT government moved to put together a policy around drug checking, and also led to the development of Australia's first fixed site, so bricks and mortar drug checking service, which is in the city here in Canberra. And that's just celebrated its 2nd year of operation. Other states and territories have been talking about drug checking in this time as well, and Queensland also established a drug checking policy and numerous services as well this year. So Queensland is now operating in a pilot of several drug checking services at festivals, as well as a fixed site drug checking service in Queensland as well, which is really exciting, and that's underway. And we've also seen a small pilot at one of our medically supervised injecting centres in New South Wales, which is funded by a research grant. So, you know, after years of advocacy, there is movement in Australia. It is slow, but it's starting to gain momentum, and John and I will talk about that a bit more later. So you might be asking, it's a very reasonable question, you know, why would we offer this? What's the point of drug checking? Well, people who or proponents for drug checking say that it's useful because we are talking about an unregulated market. So unlike alcohol, foodstuffs, other substances that we buy down at the shops, people are buying substances that have not been tested or regulated. And we know that in the illicit drug market, substances that people commonly buy will include additional adulterants and also vary widely in purity. And there's really no way for people who use drugs to know whether there is an unexpected substance or the strength of their substance. So there's really no other way for people to do that other than through drug checking services. And then as we see an increase in synthetic opioids, which John will talk about a bit more later, there's also an increasing need to offer drug checking, as opioids are related to the majority of drug-related deaths. And then also we're seeing this rise in new psychoactive substances. And what that means is that there are new substances coming on the market, which are sometimes sold as benzos or other things, but are actually completely new psychoactive substance that we have no understanding of what it does to the brain or the body, and therefore people are ingesting substances that they are unsure of what their harms are and unsure of how to reduce those harms. So harm reduction. So what, the intention of it, what is it? What do proponents say it's good for? And this is something that is worth talking about, because there is a bit of misunderstanding. We know the Australian public is largely in favour of drug checking, but of course there are some opponents, and there are some reasonable questions to ask around why drug checking services are worthwhile including and putting money into. And one of the main misunderstandings that are around drug checking is that it's a bit of a green light, red light system, where people bring in a substance and it gets tested and people say, oh, it's what you think it is, go ahead and use it. Where in fact, the overall intention of drug checking is to minimize the risk of death and other harms. So drug interactions, poisonings, distress. And most drug checking services include trained people, whether they're medical professionals or harm reduction specialists, to engage with people around, what medications are you taking? How might they interact with the drug that you plan to take? What kind of environment are you thinking about taking this drug in? You should consider, upping your water and, reducing your dose. So the overall intention of drug checking is not a green light, red light system, but is in fact around, based in the philosophy of harm reduction, which is that people do and will use drugs. So being able to reduce potential harms from that is of benefit to them as an individual as well as the population. And then in terms of digging a bit more around, this kind of concept of harm reduction and drug checking, at the individual level, we see that drug checking services connect people who use drugs to information and professionals. So it's a way to engage people in good quality information about using drugs. It's reporting to them the contents of their drugs so that they can make an informed decision around avoiding something that's particularly dangerous, using smaller quantities, avoiding dangerous combinations and so on. And then drug checking services also operate at a population level. So as I mentioned before, many drug checking systems are connected to the health system and public alerts. So it's a way for us to get information out to the general public around particularly dangerous substances that are circulating. And it's also gives us better information than you can get from police seizures and so on, to be able to aggregate data and provide insight into trends in the drug supply. So proponents, so it is argued then that the intention, the aim, the success of drug checking services are that they're really unique. They're a unique way of engaging people who use drugs, including often those who would not generally access health-related information about their drug use. It is a way to provide non-judgmental health advice. As we know, stigma and discrimination are risk factors for poor health outcomes for people who use drugs. And they're also offering, often these services offer a range of harm reduction, mirroring the engagement already seen in things like needle and syringe programs and other drop-in centres. So it's really an opportunity for people to talk about their drug use and to link in with other health and community service professionals if people need it. Yet there still is a debate. And there's been some really interesting, lovely sociological work around this debate. And so why are people for drug checking and why are people against it? And interestingly, there's some real similarities in the groups that are for drug checking and those who are against drug checking. And ultimately, they share a similar goal, which is saving lives. However, the beliefs and values underpinning their arguments for why we should or shouldn't have drug checking tend to differ. So people who are for drug checking proponents will tend to look at the evidence to date as quite favourable, and that really argue in that philosophy of harm reduction, that provision of a safety net, so that provision of giving people information is good because people are going to use drugs anyway. The importance of informed choice, so and people are going out there and getting information off the internet and other less reliable sources anyway, so giving people good quality information to inform their choice is positive, and it's also able to provide more services to an underserviced population. Then the opponents have differing views on that. And again, they would argue that we shouldn't offer drug checking because we want to save lives. The evidence to date is equivocal, that there's not enough evidence. And interestingly say that offering the safety net is not a positive thing. They see, again, it's, sort of talk about that green light, red light idea, or the honeypot effect, that you offer a service like this and it's going to attract more people to use drugs. They talk about the analytical technology and the unreliability of it to be able to provide adequate information on that, and John will be able to talk more to that in a minute, and then argue essentially against the philosophy of harm reduction, which is no such thing as safer drug use, and services like this are encouraging and creating more harm than safety. So let's have a look at the evidence. And it's interesting, I started off by saying, drug checking feels pretty new to Australia, but actually it's been around for a long time. And so asking this question, is there good quality evidence? Do we need more? Is the evidence unequivocal? Well, I'm kind of yes and kind of no on that one. We do have evidence to show that people want to use drug checking services, which is good. People want to reduce the harms, want to increase their safety. A lot of service users, particularly in Australia, we've found out that it's the first time they've ever talked to a health professional about their drug use. So it is creating a link to people who aren't otherwise necessarily accessing quality information about drug use. And we know there's behavioural change. So in Australia and Europe, there's some research to show that people are more likely to discard of, use less of, implement harm reduction behaviours, particularly when an unexpected substance is found and reported in a drug checking service. So we are seeing some indication of behavioural change. And then also from Europe, we can see where there have been drug checking services for decades, that the prevalence of illicit drug use is not out of control in these countries. Death from drug use is not increasing. So that kind of idea, that honeypot idea that offering drug checking it will increase drug-related harms, doesn't sort of bear out in the European context. But that's kind of it. There's actually a lot of questions as well. The evidence is not, I would say the evidence is not unequivocal. There's still a lot we don't know, and there's still a lot we might know, and there actually hasn't been a lot of research. There's a lot of sort of internal evaluations that have come out of these longer standing drug checking services, but I would argue there's utility in better understanding some of the impacts of this particular harm reduction service and where it fits in the puzzle of all the other ways that as a society we'd like to work to reduce the impact of harms related to drugs. So we need better research, I argue, around the impact of drug checking services on reducing harms at the individual level, at the group level, because we do know that even though we're in research, we tend to be measuring at the individual level. In fact, that a lot of people come in as a group. A lot of people are coming in as an individual, but they're representing in a group. And a lot of people take that information and it spreads throughout their network. So we don't know much about where that information goes and how it's used. And then also we don't know that much about the population level impacts of drug checking. So we don't really know much about if there is any impact on drug-related deaths or hospitalizations. And also the impact of drug checking services for the people at highest risk of death, which are people who inject drugs, particularly opioids. We know that across North America and Australia, that people who inject drugs are not accessing drug checking services regularly, that there are barriers for that. We don't know a lot about why, and we need to, thinking about offering services for underserviced populations that need, we absolutely need to know more around how drug checking services could reduce death amongst people who inject drugs. So next steps, I think this is my last slide before I hand over to John. So the scaling up of drug checking in Australia, it's pretty much, if not, but when it's happened, with lots of discussion around different jurisdictions. We've got the ACT and Queensland on board. Victoria has approved Victorian government has approved the use of drug checking services, and some other jurisdictions aren't far behind. So that's absolutely being scaled up in Australia. I would argue that whilst there's lots of positives in that, we also need to think about what types of drug checking models we want to advocate for in this space. How can we best serve people who are high at risk of dying from overdose? And we need to apply evaluation and research methods that are just more effective at better understanding how drug checking can be effective and what it's offering the community. We need to know more about behavioural change, population impacts, drug market impacts, and health and public warning systems. So there's a lot more to be done in this space, and over to you, John, to talk about some of the implications around that and some of the wish lists that you have around that.
Thanks, Anna. Thank you. I think I felt like I learned more about drug testing in that last 15 minutes than I have for a long time. So thanks, Anna. This section is really about if for us the question, what does success look like? We, when Anna and I were talking about this, we sort of wanted to expand the idea of what success was beyond a behaviour change in an individual, because in terms of how the majority of the population understand drug checking, it seems that it's very much, does it change the behaviour of the individual who's receiving information about the substance that's just been tested. And what we wanted to do was just to contrast different knowledges in a way, and a way of thinking about this particular scene of contested knowledge by looking at it a little bit differently. And I sort of wanted to start off with this, the public presentation of what drug checking looks like from screen grabs from 60 Minutes. And often the sense that there is an impending sort of catastrophe that we need to respond to, and that somehow drug checking is going to relieve us from the consequences of this catastrophe. And this is from an interview with Mary-Ann Jauncey from the injecting room in Sydney, and was talking about this particular emergent problem that we have with a category of drugs called nitazines. They're a synthetic opioid, and they've emerged into the Australian drug market probably in the last 2 or 3 years. They're more potent than fentanyl, much more potent than morphine or heroin, and as a consequence, North America has seen quite a lot of carnage related to the accidental poisoning from nitazines. And there's a sense that what catastrophe we're facing at the moment is not just around the individual, but just a sense that there are some problems with our systems. So Mary-Ann Jauncey says that we only do testing after the event. Why do we wait until the overdoses have happened? Surely it makes sense to put information and power into the hands of people. And that more importantly, beyond the individual, that what we're seeing at the moment is probably the most unstable drug market we've ever seen. So in a sense, the framing of what success looks like for drug checking goes from the individual to a much broader issue about how does drug checking or success with drug checking affect the stability of the drug market. And so we just wanted to tease this out a little bit, because what do we actually see at the moment? Well, in terms of overdose deaths nationally, the vast majority of deaths from 2002 to 22 have been from opioids, and then interestingly from benzodiazepines, and then stimulants, alcohol, and the rest of the list. And at the bottom of the list is something like cocaine. What we tend to focus on are the killer drugs, but we don't tend to talk about benzodiazepines or anti-anxiety or sleeping tablets very much. We know that there are two populations of people who are interested. There's what we call the psychonauts, or those who are interested in psychedelic use. And then there are dependent drug users who also may be interested in it. But what we also know is that depending on the service model, that this type of drug checking service that's put in place can differentially engage these presumptive drug consumers in different ways. We know that in Finland, for instance, in Helsinki, that there was a model of drug checking whereby the psychonauts used the drug checking service really effectively, but that was pretty much it. When they offered the drug checking service to people from needle and syringe programs, then the uptake of the service, even in the first instance, was very, very low. What we have also is that we have some fantastic evaluations that have been done, and Anna has been responsible for some of that. Also from work from the UK, from Fiona Measham, where there's sort of very interesting and patchwork of understandings about the processes of particular drug checking services, but that not all that information is actually made apparent, and not the different understandings about drug checking services are very patchy. So we tend to, again, focus on the behaviour change for individuals, but not necessarily the system change. So Fiona Measham's done some really interesting evaluations in the UK, where she's found that actually, a drug checking service can have an incredible impact on the health service provision around festivals, not necessarily because of the information that's provided, but purely because it's an intervention into the service system itself. What we tend to see in the media scripting is a kind of drug panic response with heroes and villains. And what I think we have at the moment in Australia is a policy environment which is in transition. So given this, the real question is, what does success look like given that mix of different elements in the soup? I'll use a food metaphor, but it's probably not great, but we'll run there. So we can focus on individual impacts, or we can focus on drug checking on a broader impact in the market, given the sort of framing that we've talked about already. And what I'm going to cover here, and I'm just going to do it really briefly because I'm actually just really conscious that it's probably the questions might be more interesting than the content, but we'll give that a look. I want to actually just ask the question about what the impact of drug checking has, not on the behaviour of people using the service, but on the regulators of the drug checking environment itself. By making visible the parameters of the market, what does that do to the behaviour of the regulators who set the constraints of the market? We know that there are relationships from other studies of other markets that how visible the market is can actually make a regulating agency behave quite differently. Sometimes regulating agencies keep the parameters of the activity of the market quite close to their activity, as we've often seen in alcohol industry, where it's still difficult to get consumption data out of the regulators. So this is actually quite an important impact, is to see what impact drug checking has on the regulator itself. And then what is the impact on what I think is actually a kind of a consistent theme within drug policy, which is fear. And what impact does drug checking itself have on the mobilisation of fear, which is a very important leverage point within the spotfire politics of drug policy. And I've started with this picture here. It's a billboard outside a safe consumption site in British Columbia, which warns users about drugs laced with other substances. And this is from some media, so it's not it's a public document. But I think what's really interesting is we have this smattering of information about the market, and the expectation is users will use that information to somehow impact on both themselves and also the market itself. And we'll come back to this because this idea of passive engagement with information, and see what do we know about that and its capacity to change. I'll start with the first question, which is about markets and about the way we think about markets. And the way I'm going to actually structure this is very, very different to the way we think about a sort of supply-demand market economy approach to markets. What I'm going to draw on is the work by Asbers, who uses the framing of markets through economic sociology. And in this particular framing, there are different types of markets. And he talks about two attributes of markets that are co-present and coexistent, that most markets have the attributes of both being where the goods in the market are determine the nature of the market. And so he talks about two types of markets: status markets and standards markets. And status markets and the attributes of both are actually co-present. So it's not a dichotomy as such. An example of a status market is where the value of the good is socially mediated. So, this shirt I've got here is not particularly famous or fashionable, costs me, $25 from, thing, and the value in it is, attached to me. If I was a highly credible fashionista wearing a very known brand, then the value of that brand would be attached to my status, and vice versa. And that the status market is usually attached to sort of fashion industries, clothing, accessories, things like that, consumer garments. We also know that the value of the goods change by the status of the consumer identity. And in fact, the insider information is really important about the value of the good in the market. So if I know where to get really good quality gear, then that makes my information, gear being drugs, then that makes my information very valuable and actually adds to my status. And so there's a relationship between the information in a status market and status and the value of the good. In a standards market, it's the complete opposite, where the value of good is not fixed to the status of the market actors, but the value of the good is set by transparent standards. So if we could talk about the purchasing of chemicals or pharmaceuticals, then they're very rarely attached to the status of the consumer, except if it's Ozempic, but that's another issue. The standards market is where there's agreed upon transparent standards that everyone knows, that everyone says, okay, well, this drug, this particular substance actually has a set purity, it has a set identity, therefore, this is how much you should pay for it. And in fact, we see this unit pricing approach to a number of our goods that we might get on the stock exchange or when we buy flowers from the market, especially when we go grocery shopping, at least, that we generally have a very good understanding where things are unit priced, even down to the value of, you should be paying 99 cents per kilo for this particular item. What ASPRS also says is that the roles of the actors in the market can switch depending on the type of the market. So in a bazaar, people can buy and they can sell. And we see the same sort of thing happen in drug markets where people can be purchasers and they can be sellers of the goods. And one of the suggestions here is that this framing from economic sociology of what actually the identity of the market, we could actually think about what's the impact of drug checking in the relationship between a market being more of a status market and more of a standards market. Because what drug checking actually does is provide standards. And so what we might be thinking about here is that, well, is drug checking a technique or a technology that actually will change, one, the information and the value of that information, and also actually establish standards in the market. So we actually might shift the balance from drug markets being status, in the majority status markets, to being more in the majority of a standards market. And this might be something that we can explore a little bit more. Nobody's had a look at this, but I think it might be interesting. One thing that we talked about before we talked about the differential engagement with the different type of service model. Well, we know already that the purchase power and the segmentation of outcomes can be seen in terms of the proportion of deaths across the different quintiles, the socioeconomic divisions within our society. We can see that there are some substances such as cocaine, where we see the proportion of people with poor outcomes from cocaine use are actually experienced in one quintile, whereas for other substances, it actually can be vastly different. So with fentanyl, tramadol, the synthetic opiates, it's actually the opposite. So we get this segmentation of consumption, a segmentation of consequences, and we should also think about the segmentation of the likely users of drug checking according to those patterns of consumption and the consequences themselves. The segmentation is not just in terms of socioeconomic, but we know the segmentation in terms of poor outcomes from drug use is that we see a vast difference in terms of indigeneity. The rate of deaths from a drug overdose for our Indigenous First Nations people is vastly higher than that for our non-Indigenous, and this trend has actually accentuated and getting worse in the last 10 years. So we need to think about this segmentation in terms of drug checking, and I'm not sure we've really provided some good answers or good questions about that just to start with. So what does success look like in terms of one of the other potential impacts of drug checking that was discussed right at the very beginning? Well, what do we anticipate about the stability of the market? And if we contrast, and this is from the Pennington Institute's recent document around annual overdose report, and we're looking at the number of deaths from 2002 to 2022. And if we actually contrast the number of deaths and the trend lines associated with that, you can see the dark blue line is showing drug deaths and a line of fit over that time period. And you see that drug deaths in terms of number of deaths is increasing dramatically. If we contrast that to a different market whatsoever, and we contrast that to road traffic accidents and road traffic accident deaths and car crash deaths, we can actually see that the trend for those market environments is actually moving in the opposite direction and is far less volatile. And so we can actually get a sense of what's the level of stability in the market that we're working with. And is drug checking likely to be seen as a success in that particular market and as this market indicator shows? Given the volume of drug checking that's undergoing at the moment, are we likely to see an impact on death rates? If we do, how will we see them? Finally, I just want to ask some questions about the visibility of regulators within this environment and the impact of drug checking on the regulators themselves, because it goes to the heart of the question about the provision of drug checking, about the role of government and the role of government in protecting or providing a safety net to vulnerable populations. Or is it really about providing better choice for a neoliberal subject? Are we wanting to engage with rational decision makers in a market that has traditionally been not framed as a rational consumption market? So is this about consumers or is it about people who are citizens? And this is some of the questions that I have with regulators quite often. And it is part of the language of what is the role of government in the provision of drug checking. And I think it's worth asking some questions about what our objectives are, and are we targeting our service models to vulnerable populations, or are we targeting it to consumers? Not that they're any different, but in terms of how we prioritise the model itself. Finally, what is the impact on the mobilisation of fear? Can we anticipate that drug checking might reduce some of the spot fires by actually having some standardised information about the market? Is that likely? Is it possible that it might reduce the kind of mobilisation of the fear about killer drug epidemics, et cetera, et cetera? Are we likely to see a visualisation of the metrics? We see it very clearly from CanTest, which is the testing service in Canberra. But what's the impact of this visualisation? Will it reduce or will it enhance the politicisation of the drug policy arena? How many more services will we need to actually reduce the incidence of the killer drug panic story in the media? Because we know how powerful they are. One last sort of observation is about the limits of what drug checking can do. I started the talk with a reference to a category of drugs called nitazines, which have been in the news quite recently. But I'm just conscious that here in Australia, we're very lucky to have some really experienced chemists. We've got some really great technology in our laboratories that are attached to drug checking services. But we know that that's not always the case in other jurisdictions. And in a document from North America, where there was a commentary about the capacity of the existing drug checking technology to detect nitazines in the US population, the quote from this particular commentary from March this year was that it's unclear whether available nitazine test strips, portable drug checking devices can identify the nitazine opioids that are circulating. It's unlikely that emerging on-site drug checking technologies can identify the many nitazine opioids that are circulating. as the libraries are still being developed and their limits of detection are being determined. So there are a bunch of technical questions that we need to be mindful of, but it doesn't become a stumbling point to the broader questions that were the broader answers, I think, that Anna provided at the beginning of the talk. So that's it from me. So I'll throw back to our learned moderator.
Thanks, John. Yeah, fascinating talk, guys. I just want to say thank you so much again for a really, really interesting seminar. Yeah, haven't thought about the issue too much, but it really raises a lot of interesting kind of problems. So yeah, thank you both very much. And yeah, for the rest of you here, we hope to see you at the next Helen seminar, which will be on the 8th of October. And the subject there we'll be doing is the legislation for assisted dying. So I hope you can all join us again. All right,
Okay.
thanks both.
Thanks.